adapts to life's stresses, overcomes adversity, grows stronger for having overcome the challenges, uses optimism, and experiences visions of hope. And in my journey, I defined strategies can become opportunities and adversity into actions. That was so important, and I've used that many times in my path. And yet too many people have died of cancer. It's so unfortunate, and it's the second leading cause of death in the United States. There are so many ways to support patients. I saw this article called "My Cancer, My Words." It was in Novartis, and with an expert steering committee, including the cancer support community. The cancer support community. And that's how I found out about this. So My Cancer, My Words, it was a survey of over 2,000 patients in the US and the UK on certain words regarding the disease. And patients can be negative or positive regarding the treatments and other topics. And there are very interesting items, if you will, in this article. And I want to highlight something from a doctor. The words we use are incredibly powerful. And I think we often forget, as we are talking as physicians and as caregivers, how much the power of the words can really impact a patient's ability to navigate treatments and really go through a cancer diagnosis. Stress is paramount, and it's been shown through research. Robert Eder, he is the founder of psychoneuroimmunology that was discovered in the 1970s, more in the 1980s. It's incredible with the research that's been done, including brain behavior immunity. And so many people have done research and strategies from that. And I'm just going to some topics that might be insightful, and it is insightful for me as I was looking for in my journey with resilience. Neuroplasticity is the brain's capacity to continue growing and evolving in response to life experiences. And the brain can adapt or change over time by creating new neurons and building new networks. And there was a recent event that I attended, put together by Jeffrey Bland, the founder of Personalized Lifestyle Medicine Institute. He's also the founder of functional medicine and other things, and the Gupta program. And it went into, is it all in the brain? Integrating brain retraining neuroplasticity approaches into your practice for improved patients' outcomes. And it was a fascinating event. And in part, it talks about trauma can influence negative emotions and a danger mode, if you will. And by rewiring pathways in the brain can create retraining skills and resilience and so much more. And the Gupta program is doing that in their work and seems quite impressive. Dean Ornish is someone I've known for many years. He's been doing his work for over 40 years, and he demonstrates how lifestyle medicine can reverse, treat, and prevent chronic diseases. And he does mention, as I've known him in his presentations in the past, about, to eat well, move more, love more, and stress less, and so much more. He's been working with his research. He lives close to the San Francisco Bay Area, and he's done work through the University of California, San Francisco, other hospitals in the US and abroad. And Ornish Lifestyle Medicine is the only scientifically proven program to reverse heart disease without medication or surgery. And along with that, he's been doing work in prostate cancer, obesity, depression, Alzheimer's. That's been going on for many years, and so much more. The 3 secrets of resilient people. I discovered this information in a TED Talk by Lucy Hone. She is from New Zealand. She did work in the US, and she went back to New Zealand with her husband, 2 boys, and her daughter. One day, as she describes in her TED Talk, her daughter went with her really good friend and her mom. They were all going to a lake, and they went in a car, and they were killed. And the grief that she endured was overwhelming, as one can imagine. And she had to then find a new way with resilience to incorporate that differently. And as so many people endure challenges in life, this really is beneficial to me. And without going into all details, that suffering is a part of life, totally true. Number 2, to switch the focus of your attention to the good. And in part, she shares research on 3 good things for 6 months. And the findings showed higher levels of gratitude, higher levels of happiness, and less depression. And it is essential to have an intentional, deliberate, ongoing support to tune into what's good in the world. And she also said that is what I am doing helping or harming? 3 sentences. It really makes a difference. Gratitude turns what little you have into abundance. Gratitude is so much more than saying thank you. And gratitude changes your perspective of your world. I've known about HeartMath Institute for many years. They do incredible work, research, education, training, and so much more. And they focus on coherence as well as uncoherence, lack of coherence. And with coherence, it's a harmonious state where our hearts, minds, and bodies are united in cooperation and flow. And looking at, looking at positive emotions, looking at to increase the brain's ability to make good decisions, to boost the immune system, and to see negative emotions that create nervous system chaos, but positive emotions, again, do the opposite. And looking at the human heart's magnetic field, perhaps, people aren't into that, but there has done a lot of research into a biofield that goes in various directions, and they can be quite simply the good, the bad, and how it impacts other people as well. And in their research, in part through coherence, technologies from HeartMath, which aren't expensive, looking at and what they've done for, again, many years, the heart rate, looking with emotions, the frustrations and anger, that is showing that it's in coherence. And emotions such as appreciation and compassion, the heart rate is showing that it is coherent. Dalai Lama, a wise man, he said, your own brain, your own heart is our temple, and the philosophy is kindness. Kindness is medicine, and love is medicine. That's giving to ourselves and giving and are receiving, and that can be restorative. And in severe vulnerability, people may especially need love from the community, and that kindness and love can help heal wounds. Touch is so important in my mindset and for others. Rachel Naomi Remen, she's written a number of books, training for practitioners, and much more. And she said, touching is a very old way of healing. Something in touching strengthens the will to live in us. Healing is evoking the will to live in another person. It comes about not by doing something, but by letting another person know that their pain and their suffering and their fear matter. They really matter. I put together integrative cancer care for the whole person. It improves quality of life, cancer survival, and cancer prevention. And that includes and features the physical body, mind-body connection, spiritual vitality, social support, and a cleaner environment. In addition, it's essential with self-care strategies. Of course, self-care strategies are included with some items with integrative cancer care for the whole person, as well as integrative whole person health and healing. And it's essential to be proactive, motivational, commitment, and to know that each person matters. There's so much more to define resilience. And I ask you, what is your meaning, path, and legacy? What is the resilience that you want to do for yourself and other people? I know that I want to do a tremendous amount of work that really inspires me through resilience and so much more.